So what we're going to do now is we're going to scan up using the iTero scanner. Miriam is going to scan the upper arch. The advantage of this is, and I'm sure everybody's found this, when you do one implant it's not so terrible. When you do multiple implants, the differences between the pouring of the stones, between the impression material, with teeth you have a little bit of micro movement. You get away with these things. With implants there is no movement at all. So your fits must be absolutely perfect. The iTero scanner and using digital scanning allows us to accomplish that. Since using the iTero scanner almost all the time I have a perfect fit. Contacts are perfect. Fit on the margins is perfect. Bite is perfect. Why is the bite perfect? And this is actually very interesting and I'll explain it to you. Again, you'll see it when I do the scan. With iTero scan, when you have the patient bite, you're having the patient bite into a full, hard bite. And what that does is it compresses the periodontal ligament slightly. By compressing the periodontal ligament slightly, we have a much more accurate, on a hard bite by the patient, we have a much more accurate bite surface. When the periodontal ligament is not compressed and then the patient bites hard on food or even by themselves as an abruxer, right away you've got a heavy contact on a tooth that you shouldn't have. So the iTero scanner, because it has the patient biting hard bite, compensates for that. Scans, keep them pulled inside. We have the interproximal scan, the jig scan, and now we're going to get the tooth scan in bite. So Anton, I want you to close down for me. Squeeze hard and hold, okay? I'm going to sneak in there. And this is a really nice one because we've got enough room to actually get our scanning jig. Sometimes that scanning jig gets in the way of the bite. In this case I would just take it out and do a couple of extra scans, but this jig is the perfect height. And there we go.
So I'm going to make sure not to force forward. Guided scanning is done. You can now continue to review or take additional scans.
And there it is. Let's have a look-see. Okay, so here we can see we've got the bite. The missing data that you see here is actually, it's there.
It's there?
It's there. The data is there. I know this because I can see the
data back
pictures.
then, they will process them.
They will process it, and you can take multiple pictures to try to get it to fill in, and all you end up doing is putting a lot of data in there, which tends to confuse the machine. So once you get comfortable with using this, you realize that if you've seen it in your eye, which I have, you know the data is there. It just doesn't come up on the initial processing. So I'm not particularly concerned about that. I was concerned the first time we looked at this, and I'm not anymore. This is great. And we can see the bite is there. We've got a good solid bite. If you look actually through, you can see where he hits. There's the contact points. So we're in good shape here. We've got a good scan of our jig. And now this can go back into the computer where they can then design a custom abutment and a crown and all ready to go, because they know exactly where that implant is and they know exactly the relationship of that implant, teeth on either side, and the actual bite.